Good afternoon, everyone. I'm Barbara Ham-Lee. During this hour of Another View, we'll talk about a disease that affects more than 500,000 men, women, and children in Virginia alone, diabetes. And the African-American population is even more deeply affected. In our state, 13.5% of the black population has the disease. So what is diabetes? What's the difference between type 1 and type 2? And once you are diagnosed, can it be reversed? We have a panel of medical professionals here to answer all of your questions about diabetes. It's the Newby family of doctors, and this is Another View on Health, right after this news from NPR.
Discussing the issues and celebrating the successes of the African American community. This is Another View.
And happy Friday, everybody. I'm Barbara Ham-Lee. Welcome to the unofficial start of the summer holiday season, but much more importantly, this is the Memorial Day weekend, the time when we honor those who made the ultimate sacrifice to our country. And we should also take the time to say thank you to those who are serving in the military and who are out there protecting us. So we appreciate that. Hope you have lots of great plans for this weekend. Just want to give a quick shout out to the 500 or so girls and young women who were at ODU last Saturday attending the Girls Conference sponsored by the ODU Community Development Corporation. I had the pleasure of serving as the MC for the event, and it was a very uplifting and fun day full of empowerment and all about girl power. So congrats to the ODU CDC for caring about the young women in our community. So let's talk about diabetes. Now, back in the day, the old folks used to say you had the sugar or you had sugar diabetes, but we're not talking about the granular kind. Here's some stats. 8.3% of the U.S. population has the disease. African Americans are twice as likely as whites to develop diabetes, and the rate of type 2 diabetes is increasing in children and adolescents. The good news is that diabetes can be managed and you can still have a productive life. And here to share with us all we need to know about diabetes is our resident doctor, cardiologist, Dr. Keith Newby. Hey, Keith.
How are you?
Glad to see you or have you back.
Oh, thank you very much. Always a pleasure to be back.
Absolutely. Joined by his brother, primary care specialist, Dr. James Newby. Hi, Jim. How are you?
I'm doing fine.
Good. Thank you so much for being with us today. And his sister-in-law, family nurse practitioner and certified diabetes educator, Olivia Newby. Hello, Olivia.
Hello.
And so it's like the whole Newby family medical thing going on here today, huh, Keith?
You got to do it. I was laughing with you at the last show, and we were talking about the next topic. And I said, I thought about it, and quickly I said, my brother and I, we talk most nights. We always work so much, and the hours come when you say, okay, when do we ever have time to commune together? It's usually in the evening time, and we started talking. I was noticing as he and I were discussing his push and his wife's push, Olivia, on this diabetes issue, and I thought this would be a perfect segue of saying, because I didn't want to make it sound like every time we have a conversation it's going to be about heart disease. And
right.
I said there are other things that are very, very important. Of course, the heart kind of has this dovetail into this discussion. But I thought, having them come in and discuss their issues and their passion about it, which is, I really admire their passion about this subject, which affects our community more than almost any other disease process we have out there. So I thought this would be a perfect time to get them in.
I agree. And we're going to talk about that. Let me give the numbers, though, because we want people out there in our audience who have questions about diabetes to give us a call at 440-2665 or 1-800-940-2240. That's 440-2665 or 1-800-940-2240. So, Dr. Newby, Dr. James Newby,
Okay.
What is diabetes? In English.
Okay. Diabetes is basically a process where the body just can't handle glucose properly or the common term sugar properly. That's how our body gets its energy from sugar. And the diabetic process it leaves a gap on how that production goes on in the body.
And so there's a difference between if you have type 1 or type 2. So what is type 1?
Type 1 is when the body cannot produce insulin at all anymore.
And insulin is what keeps the glucose.
Right, that's the hormone that the body makes that allows sugar to be processed by the body.
Okay, so if you have type 1, your body does not produce insulin at all.
That's correct.
Okay, and if you have type 2?
Type 2 is when the body can't utilize its own insulin properly. There's a variety of ways that it does, not just one set pattern, but the body just can't handle, its insulin doesn't work properly, or the body doesn't recognize its own insulin properly, and that formulates the most common type, which is type 2.
So since so many African Americans are affected with diabetes, is there, with the type 2, as you said, there's many different ways that the body can't handle it. Is there something common among the African American community in terms of how they get type 2 diabetes? Do you know what I mean? I mean, in other words, is there something that happens?
Probably would encompass the entire show, but in a nutshell, a lot of it has to do with lifestyle. At least that's my wife and I opinion, based on research and data in our own patient population and just other literature out there. There's a strong family history component, but if you really look back on it, it really goes to lifestyle, the diet that the black culture has, and it just lends itself to developing diabetes much more easier.
Mm-hmm. So, Olivia, you're a certified diabetes educator, so I assume that means you know everything there is to know about diabetes. Is that what that means?
No. What I would say, I tend to know a lot more in terms of how to effectively reduce your complications associated with diabetes, and to change your lifestyle behavior from the perspective of things you can do. And as a certified diabetic educator, it gives me a little more understanding how to work with you to change your behavior, as in being active, and the foods you eat, healthy eating.
Okay, so before we get into kind of the treatment and so forth, Keith, what are some of the symptoms? How do you know if you have diabetes?
Well, the unfortunate reality is that a lot of times there are very limited symptoms associated. What I have found in my experience is, when people come in first-time diabetics, you find most of them have no symptoms at all. You just stumble upon a blood sugar level that was checked. Like, I guess somebody comes in the hospital with some type of heart attack or some cardiac problem, and you check basic labs, you see a blood sugar elevated, and you ask them about it, and they don't know anything about it at all. And I look for diabetes because there's such a strong correlation between the two. Now, you do get some people that will develop that, they get thirsty, or they feel, dehydrated a lot, or they get fatigued easily. Certain things that can lend to when the sugars are really high. But the majority of the type 2 diabetics, they don't have these, god-awfully high blood sugar levels initially. They may be in the 200 range, which is not, when I was a resident, we get people 800, blood sugar levels just off the charts.
What's the norm? What should it be?
Well, I would say, my experience is less than 125. Now, I'm a cardiologist, so I don't treat diabetes that much in terms of that, and they may differ on that because they know a lot more than I do. But, when I was going through my internal medicine training, anything less than 125, because quote unquote was deemed as a fasting blood sugar level, less than 125 was deemed as normal, and that may have changed some. But I think the bottom line is I'll let my more expert co-hosts talk about some of the testing that you could do to look to say, are you diabetic or not? But that's been my experience. Anything less than 125 is considered normal. Okay.
What are the tests, Jim, that you should take or that a doctor would do to find out if you have diabetes? Okay. What are the symptoms?
Well, before I answer that question, I just want to kind of piggyback on what my brother mentioned. Diabetes, especially when we were in training 30 some years ago.
Stop saying that.
Doesn't want that secret out.
The majority of the time you did diagnose diabetes was based on symptoms, excessive urinating, excessive thirst. The guidelines for diagnosing diabetes was incorrect around that time, and research has shown that we were missing too many diabetics who were developing all the complications of diabetes without ever being diagnosed as diabetic, the heart disease, the strokes, the kidney problems. And so that's
amputations.
Right, and that's why so many people can have diabetes with no symptoms now, because we know what to look for in the early stages. I'll let my wife, Ms. Newby, kind of go over some of that later, but basically right now, fasting sugar, which is not eating for at least 8 hours, should be under 100. Okay, and that's the standard now. If it's between 100 and 125, you consider in that borderline zone, pre-diabetes. You may even be a diabetic, depending on if we do additional tests. Fasting sugar over 126 over now is diagnostic for diabetes. There are some other additional tests we do. One's called the hemoglobin A1C. We'll go into that a little bit more. But if that number, if I remember, if it's 6.7.
7. We want you 7 below.
7 or below for that
test. If it's over that number, that can correlate with diabetes. And there's a 2-hour test called a glucose tolerance test, where you drink, measure the amount of a sugar drink, and you get your sugars tested.
That's
1 hour.
That's a horrible test. I've done that test. I mean, I'm not trying to discourage anybody from doing it, but oh my goodness,
well,
that test takes you through changes.
Well, see, now we got 1,000 people now. So I guess I won't get tested.
No. I did get tested, and you should get tested. Please do. But it just, when you said that, because you do drink that, it's like drinking Coca-Cola syrup. And it's it still brings that thought. But I do have a question for you. When you go for your normal physical, once a year physical, and the doctor does a series of blood tests, is diabetes one of the tests, or do you have to request that be done?
That's should be a common test nowadays. I can't imagine anyone getting a physical now without that being included in their blood work.
Okay. So you get your blood work done, and you find out you're pre-diabetic. Olivia, what does that mean?
That means you have not met the standards to be diagnosed, but your probability of developing diabetes is highly favored. So we, at that point, really encourage you to change some things in your life so that you don't get the official diagnosis that set by the American Diabetes Association and the medical community. So at that point, if you're obese, overweight, any of those, BMI over, body mass index over 25, we consider you overweight. So depending on where you are, we work on changing those behaviors.
So weight has a lot to do with it or not. Although there are some people who are not overweight who have
the characteristics
diabetes,
are for type 2 tend to be over 40, African American, family history, those who had gestational diabetes. Those are the ones that we would say have a higher incidence. So if you fall in one of those categories, then we know to make sure we make adjustments at that point, depending on what's the cause.
440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. We're talking about diabetes and about its treatment and its care and how you can still live a healthy lifestyle. 440-2665 or 1-800-940-2240. I didn't mean to interrupt you, Dr. Newby.
I was just going to say, and being considered pre-diabetic, all that really means you just have a little more time to get yourself straight before we start putting you on medicine.
Okay. So if you are pre-diabetic, you probably, especially if you don't do anything, you will
become diabetic 99% of the time.
One of the things, important comments to make along that line that I deal with as a cardiologist is, and part of why diabetes is so important is because of that correlation of heart disease as it relates to diabetes. But in a pre-diabetic, a lot of people blow that off and think, well, they told me I was borderline, no big deal. If you look at the data, it says that if you're a pre-diabetic, you carry the same risk as a full-blown diabetic to develop heart complications. I mean, and people don't, they blow that off, and they really don't understand the importance of pre-diabetes. I don't really, I guess I've learned to kind of segue my things as it relates to heart problems. I don't always know all the dynamics of the labeling per se, but I know the complications as I see them. And typically when I have somebody comes in with a heart attack, if I start looking, they say, well, I have no medical problems. They say, and I don't understand why I've had this. I always look for diabetes. I guarantee you probably at least 80% of the time I'm going to find it. There's going to be something there. A1C levels a little high. It's not quite to diabetes, but it's going to be something like that. Cholesterol is a little high. You'll find that there's going to be a correlation of diabetes somewhere in there, and probably at least 80% of people. And that's the part they need to understand.
Now, type 1 diabetes used to be called juvenile diabetes. This is when you're diagnosed from a child being unable to produce insulin. Are more people type 2 than type 1?
95% of the people are type 2.
95% of the people are type 2. Okay. Lori actually joins us from Newport News. Hi, Lori. You're on the air.
Yes. I was just calling. My 19-month-old son is exhibiting some signs of typical diabetes, has excess thirst, he's kind of jittery in between meals, and excess urination. And we have told the pediatrician, and so she's aware of it. But she basically doesn't want us to doing testing, and she said that that he would get really sick. And then at that point he would need to go to the hospital, and then he would, and then it seems like that's when she would, diagnose him with diabetes. So I feel like, with the family history, that they should be, doing a little bit more than what they're doing now.
Dr. Jim Newby.
Yeah, I can answer that. And you said your child is 19 months old?
Actually 20, yes.
Yeah, at that age, it is extremely, extremely rare to develop diabetes. And that's why your pediatrician is not, I guess, being a little more aggressive for it right now. The average age, well, I won't say the average age, but the earliest age that I can remember for child developing diabetes, usually somewhere around the age between 5 to 7. And that's probably why they're not pushing the issue just yet, because normally the way they present, the pancreas just all of a sudden stops making insulin, and they become acutely ill, and then you find out for sure there. And at that age, it's just a little difficult to truly develop and not only develop, but to diagnose diabetes that young.
So there's no test at this point because of the age that she should be taking. You
I'm
think?
sure if a lot of the testing that they do, for child development, every time they go to the pediatrician, they would probably check that.
Okay. Lori, thanks so much for the call. We appreciate it. 440-2665 or 1-800-940-2240. Rob joins us from Virginia Beach. Hi, Rob. You're on the air.
Hi. Thanks. Listen, I see patients all the time who are pre-diabetic and diabetic, and I can't stress enough the importance of exercise. It's the best way to treat it if you are diabetic. And if you're on medicine, you can't let the medicine do everything. If you don't want to be diabetic, do something every day for at least 30 minutes. The more the better, even if it's just walking.
Okay, Rob, thanks so much for the call. Olivia?
Oh, yes, Rob, that is one component. And what I don't use is the word exercise. Seems like people just don't want to hear that word. So I learned to work within what they are, let's call it being active. So I generally figure out, depending on what the patient is, if they like to, when they go to a large shopping store, walk through the entire aisle. So
go shopping.
That's just one of the, and my favorite now is everybody's cleaning up because guests are arriving. Why not turn the music on and just jam? Why all that exercise will give you some energy. And what has seemed to have worked well is finding what works for them to become active without saying, oh, exercise. Mm-hmm. And that has played a role in encouraging walk the dog an extra lap. Any of those basic everyday, if they find that they cannot get that designated 30-minute, which is recommended by the American Association of Diabetes Educator and the Diabetes Association, which is 150 minutes a week, and that can be overwhelming. So initially, I always say start where you are, but let's move it wherever we are.
Mm-hmm. Olivia, let me ask you too, when Dr. James Newby says to a patient, you have diabetes. What mentally happens to that person? I mean, I'm sure it's probably a different reaction, a different individual reaction, but just overall, how do people...
Overwhelm, and because typically a lot of them have seen family members who've had devastated complications related to diabetes, so they are fearful. A lot of myths if they feel that the insulin made them lose their eyesight or limb, and whereas that is a myth, they had complications or the diabetes had already been going on so long and was not early treated. So a lot of fear often. And what do you eat? What do you do? Your lifestyle change.
So what do you eat?
I always say you can't go wrong eating a lot of vegetable greens, things from the earth, and you can just really enjoy that. Half your plate should be vegetables. Limit the starches and the fats, and fruits and vegetables, but don't go overboard with your fruit. Always, and portion control. If you can take away anything, lots of greens and portion control makes a big difference in what to eat.
How do you decide, Dr. Jim Newby, I'm going to have to separate you two. How do you decide if a person needs to be on either medication or take insulin and or both? Is it based on how severe the disease is, or?
I would say yes, severity, or if they're having a lot of symptoms of the diabetes versus they aren't having symptoms, or how high the sugar may be, things of that sort. So I mean, it's a wide variety. You don't have a standard step for everyone. You do have some standards, but it doesn't fit everyone. So you take each person individually as you do that. Those who, let's say, when we said the sugar of 126 fasting is diagnostic. You may have some people who do a fasting, the sugar's 300. So you're going to address the 300 differently than you are the 126. The 126 person, you probably start with, lifestyle changes. Tell them if they can lose weight, if they can eat correctly, if they can exercise, there's a good chance they can control their diabetes completely without medication. Person that's with the 300 sugar, you have to start them on medicine. Now, they still potentially be able to control everything with lifestyle changes, but that's going to be a lot longer process.
They need
for
a little more help. So, if you are pre-diabetic, do you have to test with your finger, do the blood test?
No, like I said, they get a pass card for a while, knowing that if they don't change anything. I tell them,
scare me.
If you do not change anything, I can guarantee you next year this time, I'm going to be telling you have diabetes.
Okay.
Or sooner.
440-2665 or 1-800-940-2240. Richard joins us from Chesapeake. Hi, Richard. You're on the air.
Thank you. I've been diagnosed now for almost 10 years with type 2 diabetes. And I'm on medication, the metformin. I don't mind saying that. Metformin, which it does keep me under control. I lost a lot of weight. When I was first diagnosed with it, I was up to 260. I'm down to 202.
Wonderful.
Congratulations.
Well, thank you. My blood sugar levels now are either 102 in the morning, my fasting 102 in the morning. But my fear is that people are pre-diagnosed with diabetes as a cure, not a cure-all, but they're put in a box. And to bring that example home, my mother, who lives with me, she's 77 years old and has MS. So whenever she has an attack, we have to take her to the hospital, and they give her steroids. Well, the steroids are going to raise your blood sugar, so when they take her blood sugar, they say you're diabetic, and she's not. And that's my fear.
So you're concerned that people are being diagnosed as being diabetic when they actually aren't? Is that, am I getting that correct?
Correct.
Okay.
Correct.
Who wants to respond to that?
I can let Jim go. Go ahead and take
just
that.
about, except for a few rarity choices, we don't diagnose anything off of one test. Even the standard for diabetes is to have 2 fasting sugars in the diabetic range. Of course, you take your history to find out what a person's on. The medical community knows that steroids can cause diabetes or just temporary diabetes. A few other medicines can do a similar thing. So you take all that into consideration also. But despite what may be the cause, if their sugar is elevated, whether it's due to prednisone, whether they're not truly a diabetic, the same effects can still take part, because it's the high sugar that's the disease process. That's what damages the blood vessels. That's what triggers all the damage to the heart and kidneys and those other organs.
Okay. Did you want to add something?
Well, just another thing is, most of the times you're going to have the other tests like the A1C level, which is that's not going to give you what that's more of an average blood sugar level over a month or so or more. Just so, in other words, if somebody comes into the emergency room, they've been given Decadron or prednisone, and their blood sugars are high. A lot of times you'll check an A1C level. That's 5.6, which is below the mark. Clearly, you're going to say, well, this person is not diabetic based on what you have. Then you're going to start looking for why their blood sugar was elevated. If it's steroids, you say, okay, that's what it is. So just to the caller, I wouldn't worry as much about that, other than, for people like yourself or your patient that actually gives that history when they go to the emergency room. They say, you're diabetic. Well, I'm on prednisone because of my MS. Can we do further testing? And that's where people like you that have that knowledge base, that you already, obviously, because your own history, you at least know what things to look out for, and you have that knowledge base to be able to convey that over to the emergency room physicians.
If you're just joining us, this is Another View on Health, and we're talking about diabetes with cardiologist Dr. Keith Newby, primary care specialist Dr. James Newby, and nurse practitioner and certified diabetes educator Olivia Newby. It's the Newby family of medical experts. We love that. And Taylor joins us from Virginia Beach. Hi, Taylor. You're on the air. Hello, Taylor. You're on the air.
Hi there. I'm sorry, my signal is weak. I'm on my cell phone. I want to talk just a little bit about what's happening today for those who are newly diagnosed. In November, I'm going to celebrate 32 years of being an insulin-dependent diabetic. I say celebrate. It could always be worse.
Congratulations.
Thanks. My diabetes specialist, after the series of tests that we always have to have throughout the year, came in one day to the office and looked at me. Now, this is after I really was having a struggle. I just went off my diet for quite some time. I guess I was rebelling after all these decades. And she looked at me and said, I'm really surprised. You should be sick right now, but you are healthy, and I'm going to get you back on track, and we're going to work together. So that being said, I looked at all of the gadgets, and it just blows me away at so many of the new, pretty electronics that we use to test our blood sugar, and how quickly I can get back my A1C. I used to wait, 3 months before I could get the number back. And testing my blood sugar, I had to urinate in a cup. I had to put the stick in it. I had to match my colors as a child. My mother sometimes would come into my elementary school to make sure I was doing this properly. Mothers don't have to do that today, but they instruct teachers how to monitor their children depending on the age and how they're taking their blood sugar. Everything we need. Those of you newly diagnosed, those of us who are rebelling because you can't grab the candy bar, or you get the candy bar and you forget to count your carbs, and you wonder why your blood sugar is plus 300. It happens to all of us, including me at times, but it's easier today, I think, being a diabetic than how maybe our parents had to monitor themselves.
Taylor, thank you so much for sharing that story. Who wants to respond to that? Dr. Newby?
Well, it sounds like you're a type 1 diabetic, correct?
Correct.
Okay. Those are the hardest diabetics, even from the time your 30-plus years of treating yourself. Normally, type 2 diabetics didn't get too much testing done as far as follow-up, because we really didn't, really check the urines that often, or at least didn't require home checks like we do now, because type 2 diabetes was kind of assumed to be less problematic than type 1 diabetics, just because of the length of time someone may have it. So I know what she's talking about as far as easier testing, because it has become easier. It may not seem that way to diabetics now, because they
don't have the experience.
Right, and they look at it as a burden when we ask them to test their sugars every day.
Olivia, how do you recommend that people incorporate the testing or the changes that they have to do into their lifestyle, as opposed to looking at it as, here's one more thing I have to do?
It's just the way you look at your outlook, your quality of life. And it's to look at it as an opportunity to live longer, to be healthier, and to visit both the doctors less. How about that?
That's enough right there, right?
That's enough right there.
One thing I would like to add to that, what we've also found to help address that, we've incorporated what we call group visits in our practice, where we gather about 15 to 20 diabetics into an official office visit, where we actually go through more teaching, and they get to see other people like themselves doing the same thing, having the same frustrations, the same worries, the same concerns, and it makes them feel better about what they're doing for themselves. And we've seen remarkable improvements in their overall control just from the camaraderie of other patients that they really get to talk to, sit down with, and share everything with the doctor, the nurse practitioner, in that setting.
Now, are these your patients for your practice, or is this anyone who can come in? Okay.
And that has been such the new way of healthcare is going, what we call those group visits, and it's peer support. You get 2 hours with the physician, the nurse practitioner, and an educator, and it's all hands-on, and it's it gives the patient a chance to feel like they are in control of their destiny. So if you get an opportunity, that is a great way to be involved, to get your diabetes better control, and to not feel it's a burden in itself.
To find a group, 440-2665 or 1-800-940-2240. Erica joins us from Virginia Beach. Hi, Erica, you're on the air.
Hi, thanks so much for taking my call.
Sure.
I just wanted to, say thank you for addressing both type 1 and type 2 diabetes. I'm type 1 myself. I'll be, like Taylor, the previous caller said, celebrating an anniversary. I'll be going on 26 years this June.
Congratulations.
Thank you. And also, I was I guess I forget, but I was diagnosed at 13 months old, and I kind of forget, like you all mentioned earlier, how rare that is. I guess kind of point out that it is important to watch those things even in children that are younger than we expect to find diabetes in.
Erica, do you have children yourself?
I don't.
Oh, okay. I was going to ask you if you were worried about your kids. Well, thank you so much for sharing. We appreciate the phone call. We got a question from Facebook that is, can you ever rid your body of diabetes through diet and exercise? Can you completely get rid of it?
I used to say no, but I have seen a few individuals who've been able to accomplish that, who really changed their lifestyle around, did everything they're supposed to do diet-wise, weight loss-wise, exercise-wise, to the point that the A1C came down to a level what people without diabetes has. And it's a rarity because most people just can't be disciplined enough to put themselves back into an ideal, health status.
440-2665 or 1-800-940-2240. Harry joins us from Yorktown. Hi, Harry. You're on the air.
Hi. I wanted a follow-up question about diet changes. This time of year, lots of great fruits and vegetables out there, but I also have factor V Leiden, so I have to really limit my green intake. I love them, and I try to eat them regularly, like you're supposed to if you're going to eat them at all. But what other suggestions might you have besides, because you're not supposed to overdo it on the fruits, and I have to be really careful about the greens that I eat, and of course, a low-fat diet. And I'm not your typical diabetic. You look at me and you'd never guess that I have type 2 diabetes. I'm not overweight. I'm pretty active. But I was diagnosed about 6 years ago and have, been struggling to keep my A1C in like the upper sixes every time I have it checked 4 times a year. So other than, more greens on your plate, what can you do
Well,
as far as diet goes?
Well, when you go to look at your food labels, look for the one word carbohydrates. And as a diabetic, or how many meals you should have, how much carbs you can have, and that includes your fruits, your vegetables, your rice, all of those starches. Anything that turns the word carbohydrates, 100% of that number turns into sugar and has the potential to raise your blood glucose level. So if you stay between the range of 45 to 60 carbohydrates per meal, regardless if it's an apple versus bread, you still stay within that range, you should be able to manage your blood glucose much better. So portion control, but staying within the 45 to 60 range.
I hope that helps you out, Harry. Thanks so much for the call. Let's talk to Jessica in Hampton. Hi, Jessica. You're on the air.
Hi. Thanks for taking my call.
Mm-hmm.
My question to the doctors, are there any alternative interest they may have for the customers that are diagnosed with diabetes other than drugs, other than pharmaceutical drugs? Because there's so many side effects, and then every time we turn around, the FDA is taking another one off the market.
I'll just throw 2 cents worth in there for that.
Newby.
I think that I think reflecting back on what my brother mentioned earlier about the lifestyle change is always probably the first and foremost and can really impact the most as it relates to that. I mean, the only thing I caution people on side effects, and I deal with this on a regular basis, I have patients that just stop drugs. I mean, just stop them without any provocation. I'm like, why is this medicine not on your regimen anymore? And they'll say, well, I stopped. I'm like, why? Well, because I read up on it, said, all these side effects I'm going to have. I said, no. I said, that says potential side effects. It doesn't mean you're going to have any of them. You may not have a single one. I say, I think you guys are misinterpreting that information. I say, when we look at a physician's desk reference on medications, and this is the only thing I have a problem with pharmacies about sometimes when they give the list of side effects, they just list them up on a sheet of paper. So they just get, it's like 8 million things up there. And I'm like, but what's the percentage of those side effects? You look at the majority of a physician's desk reference, which is what we have, they may say this drug has 12% incidence of this side effect, and there may be 2 or 3 things listed. Then it says, okay, you got 6% incidence of this, maybe 2 or 3 listed. But then you see these 8 million side effects is less than 1%. So, the problem is there's a potential there. So I don't think that, there should be that because if they have side effects, that's one thing. If you get put on a drug and you have a side effect, that's one thing. But a lot of times people do it on the presumption of side effects, and sometimes you need medication. I mean, you can potentially do it, I think, lifestyle change 100%. But again, that level of discipline is not always easy to achieve when somebody's shoving food in your face no matter where you go. You go to weddings, funerals, any social event, typically there's going to be a bunch of food there.
Well, and is that one of the issues when we talk about how prevalent this disease is in the African American community? Because all of our functions are around food. I mean, when you think about it, you're right. The family reunion,
and
the weather.
The foods are full of high sugar, high fat, and high salt. And all 3 of those can contribute to, and 4 out of 5 African American women are obese. So if you have that potential, of course, here you go with the diagnosis of diabetes. So it's a lifestyle change is essential.
And how do you convince people then to not only, okay, so I may say I'm going to make the lifestyle change, but then when I go to the family reunion, Aunt May over there is going, you need to eat, child.
And you can have it. We just tell you a portion. And serve yourself out a small plate, a lunch plate, a child's plate. We don't never want to say you can't have it. We just work within the parameters.
Within the parameters. Kathy joins us from Newport News. Hi, Kathy. You're on the air.
Hi. I was just diagnosed as having diabetes, and my high number was 146. But I took it seriously, and I, of course, did the blood test daily. And I realized just how hard it is for a diabetic to control their appetite. For instance, if I made a homemade soup and had noodles or potatoes in it, just from eating that, my blood sugar would shoot up. So I went on a high-protein, low-carbohydrate diet, and I was able to get it under control. I didn't have the craving for the sweets anymore, and I also lost weight, and now I'm down to a pre-diabetic number. So it is hard, and I don't think people who don't have it realize just how hard it is, that the smallest thing can set it off depending on how sensitive you are.
Kathy, thanks for the call. And I want to follow up with something that Kathy just said. She said that her number is now down to the pre-diabetic number, but that does not mean the diabetes is gone.
No, it doesn't mean that.
Okay. Okay.
And that's a misconception, because even some people who we control diabetes on diet alone, exercise alone, where we haven't put them on medicine, if someone asks them, do they have diabetes, a lot of times they'll tell someone no, and they even tell another health provider no, and they think because they aren't on medicine, they don't have diabetes. And that's a misconception that we really have to struggle with some patients on.
I would like to remind that diabetes is a progressive disease. In other words, it keeps changing. And you could be stable for a long time, and all of a sudden it changes. So that's why we don't, once you say you have diabetes, we'd like to keep our hands on you to monitor it and keep those changes.
Carl joins us from Norfolk. Hi, Carl. You're on the air.
Hi,
this is Barbara. I know.
Thanks for taking my call. What I wanted to mention to the doctors, Newby, is that I've had some of their patients and some others through hypnosis. I'm a therapist. And hypnosis, relaxation, and that as an adjunct has helped people control it. It doesn't get rid of it. It does help them control it. And it keeps them in mind that they are always a diabetic. It's like alcoholism. It never goes away. It just kind of becomes dormant. And I'll take the response off the air.
Thanks so much for the call, Carl. We appreciate that.
Well, I'll make a comment. I'll tell you what's been my theory on a lot of these things. Is like I've had people that done chelation therapy for certain things, and they do, psychotherapy for other things, and hypnosis. And I'll tell you, I mean, my brother could chime in on this. I could care less what it takes to get somebody better. If that's what it takes and it works for them, I'm like all for it. I mean, I don't get in the way. I know there's some doctors, that's nonsense and this, that, and the other. But I'm like, listen, if the numbers work, what do I care how it was achieved? As long as it was achieved, that is the main and only focus I think all of us have. So that's my little 2 cents worth.
Did you want to add something to that, the other Dr. Newby?
No, I was just thinking because, we're talking about diabetes and, but I'm not sure if anyone understands how devastating the disease really is. A lot of patients get it. They don't want it, obviously. They deny they have it. But ultimately, they don't really look at it as what I call probably the most devastating disease we have because of how much it affects the body. My brother's office, probably half of the people that have heart disease probably have diabetes as either central cause or additive cause.
What are some of the other things that can happen to you if you don't treat diabetes?
Get all day.
Well, I can tell you one thing. African Americans tend to have, and everyone, but generally the complication, vision. Every organ, vision, kidney, your heart, lower extremity, amputation. So the entire body, dental.
And just to chime in on what all this kinds of relate to vascular manifestations. The eyes, the brain, it was a stroke, the kidneys, the heart. It's all from vascular problems. And what happens, especially in the type 2 diabetics, and I can't say this with expertise, is that what happens, that high blood sugars, the high insulin levels that are produced as a result of the high blood sugars, that causes problems in the internal layers of the artery. So like the endothelium is affected by those high insulin levels, and that leads to the atherosclerotic process being accelerated, which subsequently leads to these complications. So, the thing that, and I love people, if they are showing improvement, it is better, but as my brother said earlier, it doesn't relinquish you from the problems. But what I can say is if your blood sugar is 500 versus is 126, your risk of complications goes down as your blood sugars go down.
I also want to to give you guys an opportunity to talk to the community, though, about making sure that they have an annual exam to check this out before they start getting symptoms. You talk about the changes, particularly within the African American community, Dr. James Newby. Is that one of the issues, that we just don't go to the doctor ahead of time to check ourselves out and to do some preventative work?
That is a main problem. Men much worse than women with going to get checked out. That's probably why men have more of the complications and death rates from medical conditions, because they just wait too late to go. If they just get in the habit, especially once you pass age 40, getting yourself evaluated at least once a year. Now, those individuals who go to the doctor routinely don't necessarily need a quote-unquote physical, because they're getting checked periodically for things. But if they aren't seeing a family physician who's going to at least check the overall scope of their body, they need to make sure they do that.
Okay. Olivia, I'm going to give you like the last 10 seconds before I go to Dr. Newby, because you wanted to talk about the food truck and getting fresh vegetables in.
Yes, starting June the 11th, the 5 Point Farmers Market will be at the Norfolk at the office, which is at 930 Majestic Avenue, Corporal, and it will be available from 11 to 2:30.
Okay, 11 to 2:30. Farmers Market is coming. We'll be in the parking lot.
Well, that was actually what I was wanting to make sure that comment was made. I just didn't know how much time we had left, but I wanted to make sure that was important to bring up.
Okay, and with that, we are out of time. Thank you all so much for joining us today. This is a critical topic, and I'm glad that people tuned in, and we'll be right back.
Hi, I'm LaShawn Merritt, and if you want to discuss the issues and celebrate the successes of the African American community, listen to Another View on 89.5.
And welcome back. Norfolk's oldest resident recently celebrated another milestone. She recently turned 110 years old. Yep, you heard me, 110 years old. Mrs. Burden's life reads like a history book. Our Lisa Godley had an opportunity to talk with Mrs. Burden, who shared a little of her amazing life and some of her wisdom.
ABCs of the USA, sung by Ada Jones and Billy Murray, Edison Records.
Leela Babb Burton was 7 months old when Orville Wright flew the first powered airplane at Kitty Hawk. She was 5 when Henry Ford debuted the Model T. And by the time she'd turned 18, Adolf Hitler had become chairman of the Nazi Party. In her 110 years, Leela Burton has seen a lot. One question the supercentenarian gets over and over again is her secret to living 110 years. And to those asking, Leela Burton simply smiles and looks up.
I say, I have no secret because God has all his secrets. So I really don't know anything else to say no more. Just keep blessing him and thanking him for my blessing.
Mrs. Burden is an avid reader and sharp as a tack. Just ask any of the many guests who gathered at the Lake Taylor Transitional Care Hospital for her 110th birthday celebration.
Happy birthday to you. Happy birthday.
It's hard to believe. 110 years old. She's very smart, very bright. She still has her wits about her. I mean, she just loves the Lord and loves our family.
During her celebration, Mrs. Burden read a poem where she referred to her life as a treasured scrapbook filled with pleasant memories.
It's like a treasure scrapbook filled with pleasure memories of all the time God had answered prayer through friends and family.
Even though she's lived through 2 world wars and countless historic events, her great niece, Brenda Warren Gunn, says when it comes to speaking in front of others, Mrs. Burton still gets butterflies.
She kept saying, I want you to be with me because I'm kind of nervous. I don't know if I can say it all, but I knew she could get through it all by herself. It's such a beautiful poem.
While her celebration, which included a singing tribute, continued in the background, we had the opportunity to pull Mrs. Burton to the side and learn from her wisdom. She says she couldn't do anything without God, and she thanks him every chance she gets for her long life.
Thank you, God, for my blessing from day to day. And thank you for watching over me through the night and keeping me safe. Thank you for waking me up the next morning and take me through the day.
How many people do you know who can tell you when the Titanic sank or when Roosevelt was president? Not Franklin, Theodore.
Will day in and day out make fewer mistakes in governing them.
Leela Burton sure can, and she's extremely excited to see Barack Obama in the White House.
Did you ever think you'd live to see an African-American president?
No, I didn't. No, I didn't, honey. And I thank God from day to day. I never thought that I would live to see this day.
Gunn calls her great aunt the rock of their family and a true blessing.
She's always taught all of us to treat people the way you want to be treated and always pray. And that's what we do. We just try to uphold that the best we can, you know.
And Leela Burton just keeps keeping on.
I just live from day to day, and I wake up, learn something new.
For Another View, I'm Lisa Godley.
110 years old, and we just know she's going to keep on keeping on. Time now for things to view and do in Hampton Roads.
You will be my Saturday love.
The City of Norfolk is offering a free camp this summer for middle and high school students who attend Norfolk Public Schools. It's called Camp Inspired 2013, a peer-led camp that provides outdoor activities, field trips, visual and mass media art, photography, videography, and much more. There are 3 2-week sessions, and registration for Camp 1 is May 28th. For more information, call 747-2679, and WHRO is proud to participate in Camp Inspired. Heart to Heart is a relationship seminar designed to help military members and others develop healthy relationships. Sponsored by Y2K Academy, this 8-week course begins Friday, June 7th at 7 p.m. on Pruden Boulevard in Suffolk. The seminar is free. Call 925-4545 for details. The Norfolk, Virginia Beach chapter of Alpha Phi Alpha Fraternity holds its first Rites of Passage dinner at the Founders Inn on Wednesday, May 29th at 6. The dinner will honor students mentored by the fraternity from Salem, Lake Taylor, and Booker T. Washington high schools. To find out more, call 708-4656. The Cultural Alliance of Greater Hampton Roads holds its annual membership breakfast on Wednesday, May 29th at 8:30 right here at WHRO. Attendees are encouraged to bring your summer camp, new season brochures, or program information to be displayed at the resource table. To register, call 889-9479. And the final concert of the Virginia Symphony Orchestra's Peanut Butter and Jam concert is Sunday, June 2nd at 3 at the Sandler Center for the Performing Arts in Virginia Beach. The concert will feature Disney favorites to delight both the young and the young at heart. Tickets are available. Call 892-6366. These and other events are on our website, anotherviewradio.org. While you're there, sign up for our eView newsletter, a once-a-week reminder of upcoming programs. You can also listen to the podcasts of today's and other Another View shows, or you can drop us a line and let us know how we're doing. I'm out of town next week, so join producer Lisa Godley as she and her guests discuss the critical importance of community involvement in schools. For producer Lisa Godley, audio engineer Perry Smith, Sakia Mangdom, who answered our phones, I'm Barbara Ham Lee. Have a wonderful Memorial Day weekend, and join us again next Friday at noon for Another View.